Thank you very much, Mr. Chairman. Thanks for holding the hearing. And Madam Secretary, thank you for your responsiveness over the last years. I appreciate very much the focus that precision medicine has in this budget and the President's address to the Congress. In my home state, the University of Colorado has launched a large-scale effort last year across 6 hospitals, including our children's hospital, around precision medicine. I think we ought to do more to encourage the development of life-saving therapies and ensure that they come to market. They're important to both patients and the broader economy. Senators Hatch, Burr, and I worked on expediting the approval of these types of breakthrough therapies at FDA in 2012. Since 2012, this pathway has now successfully led, Mr. Chairman, to 19 new breakthrough approvals and 55 more in the pathway. So I wonder whether you could talk about why this is receiving the emphasis it is in the budget, and what the NIH and FDA plan to do to collaborate with universities and the private sector to help spur the development of these breakthrough therapies or precision medicine.
So in terms of the why and the emphasis on it, as you're saying, there is a lot of energy and effort that is already in the private sector. In terms of the why, I think it's 2 fundamental reasons. We believe it can dramatically change how we provide health care to individuals in this country. The second reason is that we believe that this type of innovation and this type of cutting-edge research should be here at home. It should be in the United States, and that we should make the commitment and the funding available to make sure we're supporting this research, because we believe that's part of keeping our economy an innovation economy. With regard to how the FDA and the NIH are going to work together on these issues and work with the private sector, first I want to express appreciation for the support that we've received in terms of those FDA numbers that you've given. We're moving to try and move things through faster. You see that 19, the 55 coming. NIH and FDA are both going to be working together and working with the private sector. One of the things it'll mean to get the precision medicine to work and be right is that the data and information from those entities in Colorado will be incorporated in the thinking. And so it's going to take close partnerships. The 1 million person study that we're talking about, we will be working closely with institutes, and we're actually getting the input of how we structure it up front. So organizations like those that you talked about in Colorado, we look forward to hearing from.
You know, I think two important points just to quickly respond to that, and then I have one other question is, it proves, I think, to the people around here who say all is lost all the time, we can't improve anything, it's a disaster, that at the FDA, that's become the go-to place for people that want to innovate, both in the agency and outside the agency, and we ought to be doing more of that as we think about what we're doing going forward. And second, as you point out, this is about keeping American jobs here and American innovation here and driving an economy that's actually lifting the middle class. That was why we got into that work to begin with, and it's actually working. So a reminder that sometimes we can actually move beyond rhetoric and accomplish something in a bipartisan way that has meaningful results. Last week, Senator Grassley and I, along with a number of our colleagues on the Finance Committee, Senators Nelson, Portman, and Brown, introduced the ACE Kids Act of 2015. This bill would improve how Medicaid coordinates care for our nation's sickest children, seeks to reduce the burden on families who often have to travel across state lines for their children's care. As you know, children who have complex medical conditions make up roughly 6% of the children in Medicaid, but account for up to 40% of the program's cost. This issue is especially challenging given that Medicaid is largely a state-run program, and these children often need highly dedicated care in multiple states where certain specialists live. Given HHS's recent focus on alternative payment models and a move away from fee-for-service, I just wanted to ask you whether you had a chance to look at that legislation, whether your staff might be able to help work with us to provide the necessary technical assistance to get this bill over the finish line.
We look forward to working with you to understand how we can address that issue that I think you are articulating, which is because Medicaid is state-based, how do we make sure that that care is both quality and affordable across state lines?
Thank you. Thank you, Madam Secretary. Thank you, Mr. Chairman.